Hello, I'm Cecilia and I am a Professor of Respiratory Medicine here at Queen's and a consultant in the City Hospital in Belfast in Respiratory Medicine. So ARDS is acute respiratory distress syndrome, and this is a condition that happens in response to a whole series of potentially different stimuli. So it can happen in response to pneumonia or to severe infection elsewhere in the body, or in response to trauma or head injury, or for example brain hemorrhage as well. And in ARDS, the lungs become injured by some stimulus, and that causes inflammation in the lining of the lungs. The lining of the lungs then gets damaged, and the alveoli, the little sacs at the end of the airways that allow us to exchange oxygen into the blood and remove carbon dioxide out of the blood and out of the body, that little sac becomes filled up with fluid. And so the lungs that are leaky now because of the epithelial damage are filled with fluid, and that causes difficulty in breathing. Patients often then need to be put on a ventilator to help their breathing and to support the gas exchange until their lungs recover. So in ARDS, we support the patients on the ventilator, and we ventilate them gently, and we minimise the amount of fluid or excess fluid that they carry in their body, but we don't have any actual specific treatment that cures or improves outcome from ARDS. And the reason for that is because ARDS is such a complex process involving a series of different things happening. So as I mentioned, there's damage to the epithelial or the lining of the lungs. There is inflammation, and there is often either infection that is causing ARDS in the first instance, or infection as a complication of being on a ventilator. And so the way we might like to try and treat or cure ARDS would involve switching off all three of those pathways. And that's difficult, because if we want to switch off inflammation, that predisposes us to further infection because it suppresses our immune system. If we want to reduce inflammation, that also reduces the stimulus to cause repair or begin repair. And so it's actually really difficult to find any specific drug treatment that can target all three of those pathways. But over the last number of years here in the Centre for Experimental Medicine and in other universities across the world, there's been a lot of interest in a particular approach to ARDS where we would give a cell therapy product. And this cell therapy product is called a mesenchymal stromal cell. And these are really exciting cells because these cells have the capacity to reduce inflammation, to promote repair, and also to kill viruses and bacteria. And we've been working on this as a therapy for ARDS for some years, both within the lab and over the last 5 years by setting up a clinical trial for MSCs in patients with ARDS. So the cells that we have been looking at are MSCs derived from the umbilical cord. And this is really exciting because you can get MSCs from a number of different types of tissue, but they're usually quite invasive processes. So the gold standard, or the originally described MSC, came from bone marrow, but to get bone marrow, a patient needs to give a bone marrow donation, which is painful and invasive and takes up lots of staff time and time for the donor as well. Umbilical cord, on the other hand, is a product that is thrown into the bin after the baby's born. So babies are born with the umbilical cord attached to the placenta. That's cut in the delivery room and usually just discarded. But that umbilical cord, the jelly around the blood vessels of the umbilical cord, is actually full of MSCs. And so this is a potentially really large source of MSCs that we can use for patients. And the process for isolating these cells from the umbilical cord in this particular product was developed by a group in Galway called Wolfson, who perfected the technique and optimised the growth conditions for these cells in the laboratory. And then that was taken to what we call GMP level, and that's the quality of product that you need for a clinical therapeutic or for a clinical trial that is suitable for giving to patients. That was taken to GMP level by NHS, BT in Birmingham, or the Blood and Transfusion Service in Birmingham, who have a background in developing different other cell therapies and who had expertise in developing cell therapies, and who then took that process that had been optimised by our colleagues in Wolfson to GMP level to create this large cell bank for patients with ARDS. So in severe COVID disease, when patients end up in intensive care, the reason that happens is because they have developed COVID-induced ARDS. So those same features of fluid in the lungs, leaky lining to the lung epithelium or the lung barrier, inflammation and infection are all there in COVID. And we had been working, or we had progressed through the initial testing of these MSCs in patients with general ARDS, and we're ready to proceed to the second stage of testing in ARDS patients when the COVID pandemic struck. And at that time we then thought, because we were in a situation where we didn't have treatments for patients with COVID, should we be testing specifically in COVID patients and seeing if this therapy works in that group, as we would predict it should do from ARDS laboratory studies beforehand. And so we spoke with our funders, the regulators, the sponsors of the trial, and asked their permission to repurpose the study so that it would be moved from a general ARDS to a COVID-specific cohort. And they all agreed to that. And furthermore then the local R&D office at the PHA in Northern Ireland also supported us by giving us further funding to allow us to repurpose this study and deliver it for COVID patients only. And so we delivered the trial across 12 UK sites and recruited 60 patients to the study. So 30 received cell therapy product, and the other 30 received placebo or dummy drug. And we completed that recruitment in December. We are now just completing the 28-day follow-up of that cohort, and then we'll complete all the data checks and then have the statistical analysis. So it's a really exciting time as we wait for those results.